Hi, my name is Devraj. This video is a brief introduction to emotional expression as a therapeutic technique. Sometimes it's called emotional release, also a kind of colloquial or popular name that has arisen for it is Primal Scream therapy. Sometimes people have heard of it as Primal Scream therapy, and that phrase gives a little bit of a clue as to its modern origin. Back in the 1970s, I think it was, a chap called Arthur Yanoff in the west coast of America wrote a very famous book in therapy terms called The Primal Scream, followed up I think by Primal Scream 2 or Return or something like this. And in this book he explains his work with people and working with a young man who at some point makes a huge noise basically from his belly through his mouth and experiences an immense cathartic release and feels a lot better afterwards. And this became a very popular book. It's a great book. It also arises from the work of a lot of other therapists working around the 70s and the 80s with sound, particularly in America. In New York there was a guy called Dan Casrael who developed a technique that he found people could go deeper into expressing sound and letting out anger, pain, frustration and feelings when they're in close contact with another person. This work was later developed by a man called Varesh, or Denny Yuson Sanchez, who developed it for group therapy. And generally, particularly in the States in the 80s, there was a lot of attention given to the expression of sound. It became widely recognized as a valuable therapeutic tool. Here in the UK, sometimes we call it emotional expression. There's not so much of it around, and there's not so many people who are really experienced enough to hold it because it is quite confrontational, it is intense. When you actually learn to scream properly, a lot of other feelings come up, and you need to do it in a place where whoever's leading it knows what they're doing, that they've experienced not so much that they've read a lot of books or got a PhD, but they've actually logged in hundreds if not thousands of hours in the group room holding sessions like this and doing a lot themselves and then holding the space for others. Without this, it's hard to feel safe. So it's a therapy that's not so widely available, it's not so easily available. A lot of people with PhDs probably haven't done it, and a lot of people who are clinical psychologists haven't really done it, and so it's a little bit of a kind of grey, vaguely fringy underground sort of area in therapy terms. So what is it good for? Emotional expression, this primal scream therapy, is very effective for certain kinds of symptoms. Generally, anyone suffering a bit of a lack of energy, feeling it hard to get motivated, hard to get inspired about life, it's great for that. Expression is great for that. Also very suitable for people who found themselves, maybe as part of a childhood position, they started to become kind of what's used to be called as a doormat or a bit of a victim in life. They find it hard to confront situations. They tend to go with the flow. They tend to say yes to things, and then sometimes later it really goes badly wrong and they beat themselves up because they should have said no, or they should have at least put some kind of barrier up to just going along with it. But they learned as kids it's safe not to confront, it's better to say yes. People like this, it's extremely useful for to balance them so that they can start to feel okay to say no to something they don't want, and of course yes to something they do want. Likewise, people who are very angry, who basically anger is interfering with their social lives or their love life or whatever, this kind of therapy is very, very useful, because the reality is that angry people actually don't often get angry in the therapeutic sense of the word. They often get aggressive or threatening or want violence. They kind of red-faced and with a bit of rage, but they don't often know how to fully express anger in a safe setting. So it's very, very useful to balance them, to take the charge out from the muscles, out through the mouth. What else should I say about emotional expression? There's some evidence that it's very useful to treat conditions like depression, which is now very common in the UK and generally in the Western world. That's because some modern theories of depression essentially say that depression is it's depressing emotions. You're depressing your underlying emotionality. You know, your emotions are being triggered all the time in our very busy lives around the place, and the person has learned to just push that stuff down into the body, and it results in this rather heavy, slowful movement where the person feels like they can't even get up in the morning, hardly. So depression it's great to check out emotional expression and give it a try and see if it works for you. See if it works for you if you suffer depression, particularly if you just come off heavy medications, or if you're still on a low dose of like what's commonly called SSRI, serotonin reuptake inhibitors. Classically fluoxetine or one of its analogues, citalopram's a normal medication in the UK. If you're on a low dosage of these medications, you may be safe with a bit of discussion first with someone who's qualified to give this kind of therapy a try and see if it relieves the symptoms of depression. For more extreme cases in the UK, there's a lot of something called chronic fatigue syndrome, also called ME. Doctors used to call it TATT, tired all the time. And likewise, there's not much understanding now of how this condition occurs. A few different theories are around, but frequently people who've got it, and particularly if they're coming out of a particularly bad phase of it, they give emotional expression a try, and for some of them it's beneficial. Not for everybody, but it's worth a try. It's not going to do any harm, and you can give it a crack. And if it works, then you've got something which really changes your life. And if you're depressed, of course, it can take you right off medication. So that's a little bit looking at the possibilities and the applications. Exclusion criteria for me when I work with people, I ask basically two questions in advance. One is, have you ever been diagnosed with a psychiatric condition? People from certain types of psychiatric background are likely to be, it's unsuitable, it would be too confrontational for them to do emotional expression work. Particularly most forms of schizophrenia, bipolar disorder, history of psychotic episodes, this kind of thing. It's generally not so good unless you're really doing it one-to-one with someone who really knows what they're doing and who's got clinical knowledge or has got the permission of whoever's clinically supervising this individual. As I've mentioned, depression, which is of course nowadays recognised as a psychiatric issue, then it may be suitable depending on the type of depression. It certainly may be worth giving it a try. Other exclusions or things where I'm a little bit careful, if someone has a history of intravenous drug use or heavy alcohol use, I would do a bit of extra screening and maybe try them with some really, really gentle exercises and give them a chance to see how those go. Sometimes when you've been involved in heavy drug substance use, and you've got off, you need to keep yourself on a bit of a fine line emotionally and not push things too much. Someone may have been alcohol abstinent for 10 years, for example, but if they start to do this kind of work, it opens up all the underlying feelings again. And as we now know, that can trigger the desire to use again. Often we learn to cope with certain types of feelings that we disown, typically pain or anger, by seeking substances. There's all sorts of things we do with seeking substances, and those paths tend to get hardwired in the brain, so that when the feeling comes up, then straight away we want to use again. So even after a long period of abstinence it can happen. Therefore, if you're seeking this kind of emotional expression therapy, primal scream therapy, attention needs to be given to this. And generally, without making too big a deal of it, you need to be experienced to run these kind of sessions. I also run other things which you could learn in a 10-day training. For me, you absolutely could not really learn this in a 10-day training if you're going to work one-to-one or really deal with heavy emotions. You need to have logged a lot of group room hours yourself and really been there yourself so that you know what it's like to be in the absolute depths of emotionality. If you don't know this yourself, for me it's hard to hold these kind of sessions regardless of whether you're a clinical psychologist or not, or you have a PhD, psychiatrist, whatever. That's my personal experience. Okay, so having said that, it wouldn't be so, honest or ethical of me to start to really give you some massive explanations and demonstrations of some of the more confrontational techniques, because I wouldn't want to think someone went out there and did them and then something bad happened afterwards. It wouldn't leave me feeling good in my heart. But I do like to give people some level of experience and possibility. So I'm going to first of all look at a good body position that you can adopt if you're thinking of or if you're going to do emotional expression, because the intention with emotional expression is not actually just to dump a load of negative emotionality on yourself or someone else or the mirror, but it's actually to get a release from your belly. Arthur Yanov, who we mentioned earlier, also talked about the primal knot, and this is a popular theory in body-based psychotherapy or body-based therapy. Essentially that there's a knot of tension here in the belly that represents a lot of trapped emotions, and that really expressing from the guts can empty this out and relieve it and leave you feeling much more alive than you are at the moment. So, a good body position is to stand with your feet really quite wide apart, your backbone is straight, and your knees push outwards. This is very important. You see, if I contract my knees and arms inwards, I don't look so powerful, I look like a victim. And if I start staying in that position for a long time, I'm programming my mind to be a victim, which we don't want. So I'm going to push my knees outwards, and with my backbone is straight, my buttocks are tight, and my fists are tight, and my arms are by my side, and my fists are really tight like hammers. And again, I don't contract in, and I also don't make myself like a big angry gorilla, I'm going to get you. It's not about that. What you're trying to do is not, because if you're doing this in a confrontational session with another person, you need to hold certain boundaries, and you also need to be able to actually get a release from your guts. So when you start to, so you have your arms by your side is what I'm saying. Just look at it side on for a moment so you have an idea from there. It looks like this, side on basically. Backbone pretty much straight and arms by your side. And then I'm not going to demonstrate any actual shouting and stuff now. I'll look at some of the group room situations. You can see that online by looking up the Humaniversity on meditation. It's a great way to learn from the Humaniversity. They're the guys that showed me. But basically what I'm going to do is just breathe into my belly for a little while and really try and feel the energy in my belly. Immediately it creates a kind of energetic sensation in my body. That's because I've done a lot of release work. But you still may be able to feel something. Just breathing into the belly is very, very helpful. Starts to ground me and make me feel good. Okay, I feel like I'm on the earth, but like I'm solid. Okay, so that's an introduction to the basic position that's used in emotional expression when we're working with anger. And like I say, what's so wonderful about working with anger is that, on one level people are like, oh, but I don't need to work with anger or whatever. I ignore these kind of comments so much, or I engage them a little bit and point out that if you do work with actual expression of anger, all the other feelings start to come up as well, and you also feel more love. You feel a great deal more love. It's really a great emotion to work with. Thank you for watching this presentation. I hope it's been useful for you. Okay, bye for now.